Dilated cardiomyopathy is a condition where the heart struggles to pump blood to the body because of the enlargement and weakening of the ventricles. This condition is diagnosed in approximately 0.57 people per 100,000 each year, or about 250 people under the age of 19 every year in Canada. In order to understand what dilated cardiomyopathy is, you need to first have a basic understanding of the heart and how it works. The heart has 4 chambers, which are the spaces that fill with blood. The top 2 chambers are called atria, and the bottom 2 are called ventricles. Blood enters and collects in the atria first, which are like the entryways. The right atrium collects deoxygenated blood from the body, and the left atrium collects oxygenated blood from the lungs. These atria fill like balloons and then release blood through the atrioventricular valves, which are like doorways, into the left and right ventricles. Blood then leaves the ventricles through another set of valves called semilunar valves. From the right ventricle, it goes to the lungs to be oxygenated, and from the left ventricle, blood goes to the body to bring oxygen and nutrients to all of the cells. The heart is made of muscle in order to be able to force blood out of it. The left ventricle is more muscular than the right ventricle, as it has to pump blood to the entire body as compared to the right ventricle, which pumps blood to just the lungs. Now that we know a little bit about the heart, let's talk more about what dilated cardiomyopathy, or DCM, actually is. It is a progressive disease, meaning it gets worse with time. It is characterized by ventricular chamber enlargement, which leads to inability of the heart to contract properly. DCM is caused by the response of the myocardium, or heart muscle, to stress, and this can be as a result of genetic disorders, alcohol consumption, infection, hormone imbalances, and inflammatory or autoimmune responses. The disease usually begins in the left ventricle, where the heart muscle begins to dilate, stretch, and become thinner. The inside of the chamber enlarges because of this process. The disease can also spread to the right ventricle and eventually the atria. As the chambers of the heart dilate, the heart muscle can't contract normally and in turn cannot pump and circulate blood very effectively. Due to the weakening of the heart muscle, heart failure can occur in patients suffering from DCM. DCM can also lead to subsequent conditions including heart valve problems, arrhythmias, which is an irregular heartbeat, blood clots in the heart, or even sudden death, so it is important to seek treatment. Now that we know what DCM is, it is important to be able to recognize its signs and symptoms. These can include sweating, swelling of ankles and legs, and extreme tiredness following mild exertion. Other signs include fainting because blood is not oxygenating the brain sufficiently, as well as palpitations, which is the feeling of the heart fluttering or pounding rapidly. Progression of DCM can lead to pain in the abdominal area, reduced desire to eat, and excessive weight loss. Diagnosis of DCM is important to detect and treat it and prevent worsening illness or death. A thorough workup including patient history, urine tests, blood draws, and ECGs can aid in the understanding of what has caused the DCM. By understanding the cause, a physician can best promote recovery and prevent further damage to the heart. There are a number of techniques that can be used to diagnose DCM. One of these techniques is echocardiography, which involves placing a probe on the chest of a patient to get an image of the heart. This shows an enlargement of the left ventricle in the case of DCM. X-ray imaging is another test that can be used to show differences in the heart and lungs, such as heart size and structure, or the presence of fluid around the lungs as the disease worsens. Another test that can be used is cardiovascular magnetic resonance imaging, or MRI, which can show the volume of blood in each chamber, the thickness of heart walls, and the ability of the heart to contract to pump blood. Lastly, biomarkers such as B-type natriuretic peptide and N-terminal BMP can be measured to show the extent of condition as they are elevated with worsening heart failure. Lastly, in understanding DCM, it is important to understand how it can be treated. While no cure for DCM exists, there are many treatment options that have been shown to improve both symptoms and patient outcomes. Typically, the first line of treatment is medications that aim to reduce a patient's symptoms of heart failure. One of these medications is diuretics, or water pills, that are prescribed to decrease excess fluid in the body, which can reduce the workload placed on the heart as well as improve breathing. Another category of drugs that can be used is ACE inhibitors or beta blockers, which prevent high blood pressure. These drugs both have the goal of slowing heart rate and limiting stress placed on the heart. If a patient's condition is resistant to these medications, then a heart transplant is a viable option in serious cases. Until a donor heart can be identified, these patients may need the help of implantable mechanical support devices, which help the heart beat frequently and strongly enough to support the body. The short-term use of these devices until a transplant is possible is known as bridging therapy. If a transplant is successful, the patient may be able to regain a normal and asymptomatic lifestyle.